All right, we're going to go ahead and jump into another set of practice questions in our GI playlist. These are very helpful for Step 2 CK, your IM Shelf or IM COMAT. And once again, always please like and subscribe, and we'll go ahead and jump into it. All right, as always, we're going to go ahead and jump into the question. Please pause it, and you can answer it for yourself. The whole reason we're doing these questions is so that way you can test yourself. All right, now that you've done that, we're going to go ahead and jump into it. So we have a 65-year-old male with a history of alcoholic cirrhosis who presents to the emergency department with complaints of worsening abdominal pain, ascites, and fever for the past 2 days. On physical exam, he is febrile with a temperature of 101.5 degrees Fahrenheit. He has diffuse abdominal tenderness. Acidic fluid analysis reveals an elevated white blood cell count with predominance of neutrophils. Which of the following is the most appropriate initial step in management of this patient? So we want to find the management of this patient, and we see that he's sick, he's got neutrophils, and so I'm going to go ahead and highlight some of the key things I found in this passage that maybe we can pull to focus what's most important in this question. So here we go. So he has cirrhosis, ascites, and a fever. With just that combination here, you really should be thinking SBS. And SBS, and I think I had a picture here we can look at. SBS is basically when you have cirrhosis or ascites, that combination with bacteria, you really get SBS. And so it's basically an infection into the portal system, the hepatic liver, and it's really dangerous. Like it's something you don't really want to wait on treatment. And so knowing that, when you look at these answer choices, it really points us to why A is important. And I'll explain here in a minute. But you don't want to wait on treatment. Yeah, you want to know what's causing it, what bug it is. But in this situation, you want to treat first, then confirm later, and adjust antibiotics accordingly. With that in mind, the correct answer is A. Empirical antibiotics. C may be tempting, paracentesis, because you want to confirm what the infection is. But in this situation, just because the patient's febrile, history of alcoholic cirrhosis, he's older, we really do, and we have the elevated white blood cells, so we really have all these things indicating SBS. So the first thing we want to do is treat, and then we're going to go ahead and test the culture. And after we know what it is, we can then narrow our treatment to specifically treat the condition. So with that in mind, we're going to go ahead and go into some of the other answers just to explain specifically why they're not correct. So yeah, as we mentioned, SBS is a life-threatening infection in patients with cirrhosis and ascites, and prompt treatment with antibiotics is crucial. Acidic fluid culture, option B, is important in identifying the specific antigen and guiding further treatment, but should not delay while waiting the culture results. So we really don't want to do it first. We want to treat, and then we can do the culture, and then you can do the acidic fluid culture. So you want to treat first, and then you can do paracentesis, culture it, and everything else second once we know what it is, or once we've treated. Option C, paracentesis, is not an incorrect choice, but it is not the most appropriate initial step. So as I mentioned, it is something you want to do, but it's not the first, as we said here, the initial step. It's something that you would do after you've started treatment, and that would be to confirm what infection you have. And really, liver transplant and IV albumin, they're not really indicated in this case. They're just wrong answers. So really, the tempting choice here was C, but because of his condition, you'd want to treat first, then do paracentesis, and then culture it, which would be B. But for initial step, it's empirical antibiotics. There you have it. As always, like and subscribe, and please comment on what kind of questions or playlists you'd like me to start next. And that's it.